I think there are three issues that are very important to not only the scientists that are here, but to the world. First of all, I think that kidney health is very important. Secondly, I think the link between calories and the fluids that we drink. And then thirdly, I think for me specifically, I think the issue of making sure that people either know how much they're drinking on a daily basis and conceive of how that balances with what they need.
It is essential to start studying and promoting healthy hydration because there is an accepted truism in the community that water is good for the kidney, water is good for the skin, water is good for the human being. But unfortunately, this is a matter that has not been appropriately explored and studied. So we need to start promoting studies and science around it. This, I think, is key.
Young people are drinking increasing amounts of drinks which have got lots of sugar, lots of energy in. Fizzy drinks, diluted drinks, cordials. And teenagers are drinking a lot of energy drinks. And that means that actually some of these, on average, you've got to remember that this is just an average. These drinks are amounting to 200 extra calories a day.
Childhood obesity has a massive impact upon health. We just heard today back from the UK about in the future up to 60% of kids will have fatty livers because of their obesity and because of the drinks they drink and the food that they eat. We're seeing more and more young kids and adolescents get type 2 diabetes, which has always traditionally been a condition of adulthood. Sleep apnea, asthma is made worse, the orthopaedic problems, joint problems, and of course as childhood obesity progresses into adult obesity, we're seeing cardiovascular disease and ultimately premature death.
The question of water intake on chronic kidney disease is a very important one. It looks as if there's more and more patients detected, diagnosed as suffering from chronic kidney disease. Some studies suggest that up to 10% of the general population has chronic kidney disease. Many more older individuals have chronic kidney disease.
If you will deprive some people from water, one of the first subjective feelings that they will feel is all the feelings in sleep-wake area. That means they will feel less vigorous, more asleep, and so on.
We know that through dehydration, performance is impaired and is impacted in a number of different ways, and so therefore as a growing child develops and moves forward, then of course what we want to do is make sure that they're hydrated in an appropriate manner so that they can function effectively. For me it's as simple as that.
We are not completely going wrong. It's possible to probably change softly the habits of the people and to improve the drinking behavior of a lot of people in order to have a safer drink and safer water intake.
Some countries have adopted public guidelines and policies to actually improve hydration, and particularly to improve the use, the consumption of water. And actually what we need is a united effort on that and actually move forward.
Each country can share their experience how to combat dehydrations specifically for their country, and we can learn each other how we can also do the same to other countries.
Indonesia has added a whole strata for water, just emphasizing the point that water is so important as part of everyday life.
In Argentina, the main issues related to hydration are not very different from those that we found in almost any other country. Number one is the question we make: how much is necessary of hydration for a healthy lifestyle? And after that, there are different ways to hydrate the body.
Water is the most important source of hydration. It should be, and we should really go back to what humans consumed up to about 11,000 years ago, which was just water.
The Hydration for Health meeting has been an extremely beneficial meeting because it's been able to put together a number of stakeholders which are working in the area of fluid and chronic kidney disease, but also has brought together professionals directly from the field that need to start learning about the concept that there is science happening around this area.